Hello everyone. In this video, we will continue with our next part of drug dosage forms. So, in this video, we will talk about liquid dosage forms, semi-solid dosage forms, and gaseous dosage forms. So, first is liquid dosage forms. Now, liquid dosage forms again comes in many forms, but broadly it can be categorized as monophasic or biphasic. Monophasic means, say, suppose the drug is in liquid form, maybe watery form, and it is dissolved in the watery solvent. So, solute completely dissolved in such solvent. So, solute and solvent are of the same phase, that is, both are watery. When we talk about biphasic, then one form of the drug is dissolved in another form of the solvent. Say suppose solid form dissolved in liquid form or oily form dissolved in watery form. So that is biphasic. Now, when are these liquid dosage forms used? Well, advantages of liquid dosage forms are that they can be easily administered. So, for example, in children, elderly, then adjustable dosing can be given, say, suppose a full spoon or half a spoon, and it can be measured also using a measuring cup. Then rapid absorption. So when a drug is given, it needs to dissolve in the body cavities, but for liquid there is lack of dissolution step. Then there is flexibility for various routes of administration. It can be given in topical form also, IV form also, oral form also. We are not going to discuss the different routes of administration. However, we will discuss about the various liquid forms. So I told you that we have monophasic and biphasic, broadly two types of liquid dosage forms. So biphasic is mainly suspension and emulsion, while all others are monophasic liquid dosage forms. So what are these different forms? One is aqueous solution, where watery drug is dissolved in water. Then we have syrup, elixirs, suspension and colloids, then emulsion, drops, lotions and liniments. Let us see each of them one by one. So first is aqueous solution, which is a homogeneous solution of solute dissolved in solvent. So it forms a homogeneous solution. For example, mouth gargles, they have this aqueous solution. Next is syrup. Syrup is where the drug is dissolved in concentrated solution of sugar or sugar substitutes. It is mainly used to mask unpleasant taste. Then we have elixirs. Elixirs means a drug is dissolved in an alcoholic solution. So such drugs which dissolve better in alcohol, they are given in form of elixirs. Also, this alcohol acts as a preservative. Then we have suspension and colloids. In this suspension and colloids, as I told you before, that suspension and emulsion are biphasic forms. So in this suspension, we have solid particles of the drug which are dispersed in liquid medium. Okay, solid particles dispersed in liquid medium. So when these drugs are kept, because it is not forming a homogeneous solution, the drug particles will settle down at the bottom. Okay, so you will see in the suspension the drug particles are settled down. So it is recommended that both suspension and emulsion, if the drug is in these forms, then we have to shake properly before use. Otherwise, you will be only consuming the solvent. Okay, so this is suspension. Colloids is where again it's a form of suspension only, but the particles, the drug particles which are there are very small, and you cannot visualize them. They are so small that with the naked eye they cannot be visualized. Then next is emulsion. Emulsion is a mixture of oil in water or water in oil. The drug can be watery, which is dissolved in an oily medium, or it can be oily, which is dissolved in a watery medium. So obviously these liquids are immiscible, and these emulsions or suspension where the particles are immiscible, they are used, say suppose in condition that if the drug is dissolved in aqueous solution, then it is destroyed. Or in case of emulsion, say suppose a drug is there but it is not that much soluble in water, so it is kept suspended. And sometimes also for slow and prolonged release of the drug, in suspension the drug is in the form of the solid particles. So I told you before that when it is liquid it is easily absorbable, but sometimes when we want a slow and prolonged release of the drug particles, then suspension can be used. So understanding that why sometimes this biphasic liquid forms are used. Next in liquid is drops. Drops can be for oral ingestion or they can also be for external application to eye, nose or ear canal. And this oral injection drops are especially preferred for infants or young children. Very famous example is polio drops. Then comes the lotions and liniments. So lotions are basically can be suspension, solution or emulsion, and this lotion and liniments are for topical use. Okay, so they can be solution, suspension or emulsion. Main difference between the lotion and liniments is that lotion is very easily applicable and does not require any rubbing. So it can be absorbed from the skin without rubbing as well. However, liniments to be applied need rubbing so that they are better absorbed. Okay. So those were the various liquid drug dosage forms. Moving on to the semi-solid dosage forms. So in semi-solid dosage forms we have ointment, creams, gels and paste. Okay. So first is this ointment and cream. Ointment are cream are the greasy preparations, while gel and paste are non-greasy preparation. And these all four forms of semi-solid dosage forms are for topical application to skin and mucous membrane, and because they are topically applied, they have localized effect wherever they are being applied. So first is ointment and cream. Ointment is much more greasier compared to cream. So this is thick greasy preparation and is oil based. So wherever it is applied, it causes occlusion. Okay, occlusion means it will act as a barrier and it will help retain moisture in skin, and also it increases the drug absorption because there is no evaporation and the drug is locked in that particular area and it increases the drug absorption. So in this case, the oil based is hydrocarbon or waxes, and they are mixed with the emulsifier drug, and the oil based base which is used, they are mixed with means of emulsifier for better mixing of the drug and the base. The next is cream. Cream is basically emulsion of water in oil or oil in water. So this is mainly an emulsion in the form of a cream. This is smooth and easily spreadable and is less greasy compared to the ointment, and it is not providing that much barrier as compared to the ointment. So suppose if we want too much hydration of the skin, locking of the water is required, then ointment are preferred. However, sometimes these ointments can be very sticky and may not be preferable by the patient. Secondly, in some weather conditions like in summer, ointments may not be preferred. Same is the case with the cream. So cream also, it is an oily base. So that is why even though it is less greasier than ointment, but sometimes even in summer, creams may also not be preferred, but they are much better for hydration, both ointment and cream. Then comes to gel and paste. In gel, the drug is dispersed in a gel-like medium, that is hydroxyethyl cellulose. It has more fluid consistency and that's why it can be spread easily and used where non-greasy formulation is preferred. Okay, one famous example is Volani gel. Then come paste. Paste, very common, is some medicated toothpaste also can be there. These are thick, stiff and they have higher percentage of solid. These pastes can also be applied on the skin where they form a protective layer, and sometimes they can help absorb secretions from the oozing lesions, and they also reduce friction and irritation on the skin. For example, zinc oxide paste can be used for diaper rash, where diaper rash occurs because of the friction on the skin. So that protects against the friction. Moving on to the next drug dosage form, that is the gaseous dosage form. So this gaseous dosage form is mainly used for the action in nose, local action in the nose and also in the lungs. So the drug can be in the form of gases or volatile liquids which can be inhaled by a mouthpiece or face mask or even the endotracheal tube, and this can be in the form of non-volatile liquids or even fine particle solids can be inhaled, which can be aerosolized. Aerosolized means that a process by which solid or even liquid particles are dispersed into the air in the form of tiny droplets. So sometimes solid drug will be there, example being rotahaler, rotahaler, what happens that there is a capsule, a solid drug is there, and then we spin the rotahaler so that this solid can be aerosolized as fine particles. Then there is metered dose inhalers, very common, you might have seen being used by asthmatics. This is the meter dose inhaler, in which this is the mouthpiece, and here the medicine canister is placed. So this is placed in the mouth and then the canister is pressed, then a fixed amount of dose enters into the mouth. Then we have the jet nebulizers, in which a small amount of the drug in the form of the liquid is placed in an area in which the drug can be placed, and then this is converted into a fine mist. So when this machine is switched on, this will be converted into a fine mist and can be inhaled using a mouthpiece. So those were the different types of gaseous dosage forms. So with this, we have completed our liquid dosage forms, semi-solid dosage forms, and gaseous dosage forms. Thanks for watching the video. If you liked it, do press the like button, share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.